one thought that I had is to think about when, just in the normal course of events, I'm assuming that this kind of machinery has to be replaced. It has a life cycle, and I'd be curious about what that timeline would be. It may be that we could set a deadline that wouldn't necessarily be that onerous to when things would normally get replaced. So maybe that's, hearing the comments of my colleagues here, that's something to think about in the future and explore. I understand, and I'm picking up the sentiment that we're not ready to go ahead and set any kind of a date at this point. Nobody's going to make that motion, but something to think about. So I will go ahead and take the vote, seeing no other comments on that. All those in favor, please say aye. Aye. All those opposed, say no. Any abstentions? Okay, that motion carries. Thank you very much. Appreciate that. Then we'll move on to our next item, our last public hearing of the day. And this is a public hearing on the reappointment of our Commissioner of Health, Gretchen Musicant. The Mayor and the Executive Committee have recommended approval of appointing Gretchen Musicant to another 2-year term as our Health Commissioner and Director of the Health Department. Ms. Musicant was first appointed in 2005, and she was subsequently reappointed to successive 2-year terms in 2006, 2008, 2010, 2012, 2014. Before I open the public hearing, I'd just like to ask Ms. Musicant to come up very briefly and maybe give us a couple highlights of your accomplishments for the last year and maybe some things you're looking forward to doing should you be reappointed.
Perfect. Thank you, Mr. Chair, members of the committee. I'm really pleased to be recommended by the Executive Committee to continue to serve the city and its residents and to be employed by all of you. I'm proud to lead a talented and committed staff, which you had a chance to get a little sample of this afternoon. We're guided as a department by our values of engaging with communities, protecting from harm, which these examples illustrate, investing in healthier communities, and exercising leadership with attention to the quality of our work. All of this towards our vision of healthy lives, health equity, and a healthy environment. So I want to summarize just a few things we've gotten done over the last couple of years, and in the interest of brevity, I have not listed everything. So starting with our prevention of chronic conditions, we have implemented a new staple foods ordinance here in Minneapolis, which is pretty cutting edge for the country. We've supported enactment of a point of sale change to limit youth exposure to tobacco, again, one of, I think, 3 in the country. And we've broadened community awareness of sugar-sweetened beverages through working with community agencies and really have created opportunities for change. In the environment, you've really kind of heard my sample list already. We've reduced our air emissions, including PERC, by small businesses by over 25,000 pounds a year, which is still unimaginable to me even as I say it. We've completed a neighborhood-level 2-year air quality study, and we're already hearing, as we heard today, the usefulness of that study. And we've implemented the building energy use reporting that you also heard about today. In healthy homes, we have significantly increased the number of homes that are made lead safe by decreasing the intervention level at which we go in from what had been 10 down to 5, and more than doubled the number of houses we're able to go into. In youth violence prevention, we've initiated a new program to build capacity of small community-based organizations that are serving youth. We call that our Blueprint Approved effort. We've incorporated roles for young adults in a best practice gang prevention program that we had. We're calling that Build Leaders, and you have funded an expansion of that within CPED. And we're on the cusp of implementing a hospital-based violence prevention intervention program, which has been in the making for 10 years, dare say I. Under young families, we have continued to expand funding for evidence-based home visiting of young families. We have developed and evaluated new programs for young fathers and are doing that with some national attention on us. And we have expanded early childhood screening. In food, lodging, and pools, we have convened ongoing outreach to minority-owned businesses that has served as a catalyst for others in the city to also work with those businesses. And we've implemented the Green to Go environmentally friendly packaging. Finally, within our infrastructure, we've developed a new web-based data set on social conditions at the neighborhood level. And we have submitted our application for accreditation, which we expect to have a site visit in April. So that's what we've done recently. In 2016 and 17, there's some enterprise efforts that are going to take our energy. ELMS, the land management system, is going to be implemented, and I think that will significantly affect how much extra energy we have to do other things. It's necessary. It's an outdated system. It's replacing outdated systems that we're using, but it is taking a lot of energy. We also need to secure some replacement financial support for our Skyway Senior Center, or that may not remain open. And we will continue to develop new ways to support our work, building on the base that you provide from the city and the state, but we know that much of what we need to do is funded in addition to those. One of the city values is health, focused on well-being and well-being of people and the environment. And so there are three ways that we're really trying to weave that notion into work that includes our department, but goes beyond. The comprehensive plan we're getting underway this week even. I will be on the steering committee. There will be a public health table or task force that will focus on writing a chapter for public health, and we will have representation on several others as well. And so to me, that's bringing this value of health and that lens to work across the city enterprise. Another example is making public health connections to policy considerations, like our paid sick leave policy that is now being studied by a work group. And finally, our staff and myself are connected to regional, state, and national efforts, bringing information back from them, but also sharing what we're doing in Minneapolis and showing that we are a leading place for improving health and protecting our public. So I'm excited to work another couple of years on this with you all.
Well, thank you very much. If committee members did have a question, I'm sure that Ms. Kent would be happy to take that question now. We can also. We have to have a public hearing on this, so we can also take comments after I open and close the public hearing, if that's all right. So thank you very much. And I'll open the public hearing and first see if anybody is here who wanted to speak on this in the audience. And just to note from my colleagues here that we could have packed this room, if we desired to, with supporters who'd come in and rave about our health commissioner, but I encouraged her not to and myself not to try to do that. But so I'll close the public hearing, but then I will turn to somebody who can do a little raving maybe and a word of support, which is the mayor. Would you like to make a comment?
Thank you, Mr. Chair. Thank you for letting me speak in your committee. And indeed, I'm here to speak on behalf of Ms. Musicant and her work as Commissioner of Public Health for the City of Minneapolis. I've had the opportunity to work with her for many years now, and they do such a variety of things very, very well. And we have added to the plate of the health department in the last few years some of the health inspections, which I think is a natural fit, and that has been incorporated into their work very well. And this is all under Ms. Musicant's leadership. And I think the faith that we have shown in her to give increasing level of responsibility and the way that that's been carried out, and to do it at a time in the city where we are growing, where concerns about outcomes, geographic differences in outcomes, racial differences in outcomes, neighborhood differences in outcomes. So much of that work is generated and addressed in the health department, that she is a key part, and she and her team are a key part of the growth of our city, the health of our city, and the equity in our city. And, Ms. Musicant has ably led us through many challenges, being part of a team that addressed a tornado or a bridge collapse or whatever it is, as well as part of a team that day to day is making sure that we work well as a city, has been crucial. And she has been steadfast leadership with an eye on bigger prizes, with an eye on a citywide prize the entire time. She's very good at building partnerships and building relationships with other units of government, with funders in the philanthropic world, with nonprofits. Many of those relationships have strengthened our work and our ability to serve well our residents. And I recommend strongly and speak in support very strongly of Ms. Musican, and I appreciate your consideration of her nomination.
Thank you very much. Councilmember Frye, did you want to make a comment now?
Thank you, Mr. Chair. And the mayor actually just reminded me about the tornado, which was probably one of my very first interactions with the city directly. The job that you, Ms. Musican, did, along with the rest of city services and emergency services, was, I think, really extraordinary. It was impressive. You've done a lot of great work. Certainly, I can speak for the last 2 years as well. And as not just Minneapolis, but Minnesota as a whole was quickly becoming known as one of the most healthy places to live and work in the entire country, I think we're able to sort of push the agenda in more of an emblematic fashion. So it's really exciting. And also to see the plethora of work that you've done over the last couple of years, it is very impressive. I will put one additional pitch in, which is due to budgetary constraints, the park board over the last really 10 or so years has cut back on the amount of recreational services for kids, just recreation sports. While I'm not suggesting that the city of Minneapolis pick that up on a wholesale, I do think it would be important to maybe look at how we can develop some further partnerships around creating some of these teams.
Thank you very much. I also wanted to just...
and I'm proud to support her.
I didn't mean to cut you off. Okay. And I think that's a good idea, and actually that's a topic the Youth Coordinating Board talks about a lot in terms of the schools and the parks, and they're supposed to be helping do that, so we'll see. And knowing the health department and their ability to cross over into other departments and pollinate and work with others, there's no telling what influence they could help bring there, which I think is one of the strengths that we've seen with issues in the past with the health department's willingness to realize some things like even the staple food ordinance and business licensing and that. It crosses into other departments, but also thinking about exercise, walking, safe routes to school, biking, how that connects to health. I think that's one of the great skills and abilities that you've brought, and a willingness to do that. The whole youth violence prevention, where it basically was saying to public safety, let's see if we can work together so we can solve this critical problem in our city. And I think long before the state was talking about health in all policies, we were realizing that health in all policies can make a really big difference in the city, partly because of your leadership. The other thing I want to note is just the growth of the department. Mayor mentioned that, but just the ability to, in the last couple of years, to absorb more staff and grow the department, and I think you've handled that very well. I get the impression that the staff feels like they can shine and they grow and flourish, and sometimes bring out their best within the health department, and I think that we have to say that some of the credit must go to your leadership. And staff can correct me if I'm wrong later or somewhere else, but I think that's the impression that I get, and it does seem to be like it's a great department to work in, and it's very effective in the city as a whole, and you deserve a lot of credit for that, and I'm delighted that you're willing to come back and serve another 2 years, so I'm certainly going to be supportive. Any other comments or questions? Seeing none, then all those in favor, please say aye.
Aye.
Any opposed? That motion carries. Congratulations. And now recommendation go to the full council. Now we have one more item left in our agenda, and this is a discussion item, and I know that there are some amendments, because I brought some forward. This is for looking again at our animal care and control ordinance, and I think what I'd like to do is focus on the amendments and take them one at a time, and so we don't need another presentation necessarily. And I'm going to turn, first of all, to Councilmember Johnson, I think, who has some amendments that he'd like to bring forward.
Thank you, Mr. Chair. I do have some technical amendments working with staff and also based off of feedback from the Animal Humane Society as well, and just feedback we had after our last meeting. So I guess I'll move the item forward, the animal care and control ordinance changes, and then move amendment number 1. And this particular amendment is really adding in the definition of intake animals. It's basically splitting these out to be more standard with existing code and state law. So I think pretty non-controversial. I'll stand for any questions on that.
So just for those of us who might not have a copy of the ordinance, you want to tell us what number 1 does, or read it to us?
Yes, absolutely. So I'll read the replaced language. We had language around impounded animals, and that was the definition that was in the existing ordinance. And so what this would do is add in essentially, would take most of that and put it under a new definition for intake animal, and then really create space for this impounded animal definition, which is impounded animal means an animal seized or taken into protective custody by a public authority that is being held. And an intake animal means an animal that enters a public or private sheltering agency or rescue group, regardless of whether the animal is a stray, owner relinquished, transferred from another private or public sheltering agency, or is an animal whose owner requests that the animal be euthanized, except for an animal presented to a medical clinic associated with such agencies for the purpose of preventative or rehabilitative medical care or sterilization.
Thank you. Appreciate that. Any questions or comments on that? Councilmember Fry.
Thank you, Mr. Chair, and thank you for the explanation, Councilmember Johnson. I was wondering if you just yield for a quick question. Sure. So what was the kind of the underlying purpose in this, just so I understand as to why the amendment?
My understanding, Councilmember Fry, was that it's around creating more common definitions with existing laws and basically the structure of animal rescue versus intake and impoundment.
Okay.
That's helpful. Is that correct? And I'll toss over to staff if they want to add anything to that. All right. Thank you.
Okay. Then on amendment number 1, all those in favor, please say aye.
Aye.
Any opposed? Any abstentions? That motion carries then. And amendment number 2, Councilmember Johnson.
All right. Thank you, Mr. Chair. I'd like to move forward the second amendment here, which adds a little bit to the definition of releasing agency. I'll read the whole new definition, and in advance just note that really the changes around the transfers of animals. So releasing agency means a public animal shelter, private animal shelter, humane society, animal welfare organization, society for the prevention of cruelty to animals, or other similar entity or rescue that releases or transfers companion animals for adoption or placement with another public or private sheltering agency or rescue.
Any questions or comments on this new definition, this amendment, new definition of releasing agency? Councilmember Fry, I assume your card's up for the last one. Okay, seeing none, then all those in favor, please say aye.
Aye.
Any opposed, say no. That motion carries. Amendment number 3.
Amendment number 3, thank you, Mr. Chair. I'd like to move this amendment, which just adds 2 words to the 64.100 standards of care and disposition of impounded, and the words added are "and intake animals."
Any questions on that amendment? All those in favor, please say aye.
Aye.
Any opposed? Yep. Motion carries. And Councilmember Johnson, on your last amendment, I believe, number 4.
Thank you, Mr. Chair. I also appreciate the patience of the committee with these amendments. This is the largest, most comprehensive change to ordinances our city attorney's office has seen. So we're just making sure we get it absolutely perfect. With this amendment, I'd like to move this forward, amendment number 4. The change here is related to appeals procedures to change from 10 days to 14 calendar days for notification, and that is just to be consistent with state law.
Okay, I don't see any questions or comments on that amendment, so I think we're ready to vote on that. All those in favor, please say aye.
Aye.
Any opposed, say no. Okay, that amendment carries as well. And do you have any additional amendments?
I do not, and after our amendments, then I'd like to speak to the main motion.
Okay. And you should have before you some more amendments that I would like to bring, that I'm going to be bringing forward. They're all on one sheet and they are highlighted. There's 4 amendments that I'm bringing forward. Maybe I'll go through them and see if we can even move them all together. The first is to add a definition of companion animal. Companion animal was referred to in the new ordinance, I believe, about 7 times, and there wasn't a definition of it. I thought it would help clear things up if there was, and I simply drew the definition from a state statute, which would say a companion animal means a non-human mammal, bird, or reptile impounded or held for breeding or possessed by, cared for, or controlled by a person for the present or future enjoyment of that person or another. The Second Amendment changes it deletes a small section of the definition of fowl. The definition of fowl had a last sentence that said fowl does not include any domestic animal or wild animal, and my motion is to strike that. The Third Amendment I'm bringing forward is to delete under fowl. There were a number of specifics about the fowl regulations, and I want to delete letter F. It said no permit shall be granted to keep any fowl or pigeon within a dwelling unit or part thereof, nor on any real estate which contains 3 or more dwelling units. And the final one is amendment to the Prohibited Acts. This was an amendment we made at committee having to do with prohibiting bullhooks. Since then, I had the opportunity to talk to the Zura Shriners, and I understand that they have a 3-year contract with their provider, and I am willing to move the effective date out so that it won't impact their contract that they have. So this would move the effective date out to January 1st, 2019. So that'll give them a chance to make future plans or try to lobby a future city council to change the rules back, I guess. So we'll see. I'm happy to separate those out if anybody wants to pull one and discuss them. And I see that Councilmember Gordon has a comment or question.
Thank you, Mr. Chair. And I just got these right before this committee, so otherwise I would have asked our staff a couple questions beforehand. But I wonder if we could have the director come on up, and I don't know if you have a copy of these amendments. Oh, great. So I wanted to get some reaction to you. I'm not sure I understand the impact of the companion animal definition, what that might change or impact. Anyway, actually, I would like your reaction to all 3 of these, and then I have a couple more specific questions on amendment number 3.
Mr. Chair, City Council Member Glidden, the companion animal definition really won't change anything. All animals are protected under our ordinance as well as under state code. So that doesn't have an impact. It just, I think, is defining a little better.
What does it add then? So that's maybe the other way to ask it. So it doesn't maybe affect how your enforcement structure will work, is what I'm hearing. But what does it add?
What it does
then?
add is it, if in reference to fowl, I would think probably more than anything in this case, if someone has maybe a chicken as a pet versus a chicken for food or fiber, I think it would allow to have some understanding of the differences. So if you owned, if you had 2 chickens and you owned one that was in your house as a pet, and City Council Member Gordon had one that he got eggs from, one would be considered more of a livestock, whereas the other would be a companion animal. That's the way I would understand it.
Would there be any difference then in how those animals were treated under our enforcement structure? As an example, we have a lot of new definitions with how you are instructed as an owner to care for your animals, and anyway, a lot of structure around that didn't exist before. So is there any impact then to whether you personally are treating this fowl as your pet as opposed to an egg-producing creature?
There is not. If an animal is in your care and custody and control, then you have a certain responsibility to provide certain elements.
Okay. Amendment number 2?
Impact. As a matter of fact, I think it probably makes more sense not to have that in there written the way it was. Amendment number 3, where I see that impacting that is that people will be allowed to have fowl in their house. If you wanted to keep them in your garage or in your apartment, you could.
Okay, so this is where I did have a couple of questions. One is, again, I didn't grow up in a farming house, but you go back to your roots, and so I'm texting with my dad here about this, and he reminded me that many years ago people did this all the time. They had domestic animals in their homes, but I think the couple questions that I have are more about, one, are there any disease-related issues? There was a lot about avian flu over the last couple of years. Are there things that that this may impact? I don't know. No expert in that. Item number 2, we have a lot of regulations now about the condition of your home and not having, feces or other kinds of things around. I don't know how caring for chickens in your home has any impact on any of those safety issues. And then the third thing is, I thought I understood from staff that our zoning code today does not allow for keeping these type of animals in your home, but maybe I'm not understanding that. So if this was a desire, it sounds like it might be a bigger conversation to change the zoning code.
Let me start with the first part on the health part. I think anytime you live with animals, there's a certain amount of cross-contamination in respect to zoonotic diseases. I think the health department would probably be able to answer that best for you, but there's always a risk with any type of animal, whether it's a chicken or dog or cat or rabbit. So that being said, with any family who has animals in their home, if they follow certain precautions and keep them clean, keeping feces cleaned up and that sort of thing, it lessens the risk. So there's a responsible way to handle each type of species. It doesn't really matter whether it's a dog or a cat or a hamster or a chicken in this case.
Okay.
In reference to the livability issue, again, it's if you're a bad owner, you're a bad owner, whether inside or outside. Simply put, and there are regulations in place as far as dealing with the feces and hoarding situations and that sort of thing. So I think that we're covered there. And what was your third question?
Zoning code. Are there any prohibitions in our zoning code or other places that we should be aware of?
There has been discussion about zoning issues, and I think that that's a matter of interpretation as to what the zoning code means, whether it's about where the coop is or where the chicken can be. That doesn't have, as the animal part of it, the animal, companion animal and animal.
So maybe this is more a question we need to ask directly of our zoning administrator, how they would treat this amendment, but this would more just take away the regulation from the animal care and control.
That is correct.
Part of things. Okay. Thank you.
Thank you.
Thank you very much. Not sure if there's any other questions or comments. And I did have a little discussion about zoning, and zoning was more regulating the coops as accessory uses, just like it also regulates dog houses and things like that. And it really didn't talk about them being inside or not. So, but my thought was, if it appears like the zoning code is an issue, we can settle that with the zoning code, and at least we won't have these things in our code here. So, Councilmember Bender, did you have a comment or question?
Thank you, Mr. Chair. I think I do. So as I'm thinking through the zoning piece, it seems to me that the zoning code, as you indicated, the purpose there would be for us to regulate the built form, and it would seem inappropriate for me for us to try to regulate sort of the location of animals or human-animal interaction through a zoning code. So that seems to be the intention of this. So we're not trying to rely on the zoning code to be more restrictive than this would be. And then I'm not totally sure I'm following what the result of this would be then. So the result of this would be to eliminate regulations on where fowl and chickens can be, to make it more permissive if someone wanted to keep a chicken in their home, for example. Is that correct?
Correct.
Okay. All right. So that seems fine with me as long as staff supports it. I just want to make clear too, again, that I wouldn't think we would be more restrictive in our zoning code than we would be through this regulation, at least from my viewpoint.
And I don't think that we are. I think the zoning code doesn't actually refer to the creatures very much. It just referred a little bit to the dwelling units where they could. And certainly the zoning code allows a kennel in a house. I mean, it doesn't talk about whether or not you can have your dog in a kennel or one of those crates or anything, which is also what I've seen people use when they have, or a bird cage. I used to use a bird cage when I had my ringneck doves, which are defined as fowl and would be. So, Councilmember Frye.
Thank you, Mr. Chair. So I'm asking this question from a fairly uneducated position, but is that something, is keeping fowl and chicken inside, is that something that's done presently or that farmers would like to do in the city?
It's done presently. I can't say that it's, did you say farmers would like to do?
Anyone, yeah.
So I can't say that necessarily farmers would like to do it, but this is actually, there's been some discussion about this kind of on both sides of the chicken debate in our city. So I don't know if you've noticed, but there's we care for chickens. It's wrong to have chickens as food, and we want to help chickens lead a better life group. The animal rights spectrum, maybe. I'm not sure if I don't want to pigeonhole certain people or anything. And then there's the chickens for agriculture and for business. Both groups, as far as I can see, that the leaders of it think it's reasonable to think that sometimes a bird could come in the house and would stay in there. It would make total sense. In fact, with all of these amendments, there's consensus on both ends that these are fine, if that makes any sense. I think with what some of the